it's a threat multiplier. It actually exacerbates risks to global health, and by extension, threats to global security, economic development as well. So it creates dislocation, forced migration, food problems, as well as strained health systems, and that's really something that is makes it imperative that we come up with comprehensive adaptation strategies. We want to talk about Malawi's preparedness and some of what Malawi has experienced in past and what we're doing about that. So maybe we could start with that. Malawi has faced health challenges like cholera and malaria, which have been exacerbated by climate change. Cyclones, flooding, natural disasters, mudslides have also caused disruptions. Can you share a bit more about what it's been like for the people of Malawi in your country and to understand the challenges that they're facing?
Thank you so much. Let me express my thanks and gratitude to the organizers for inviting us to give us, room, a platform to share our story, to share the Malawi story on what exactly is happening. So it's a rare opportunity for us to also, develop new partnerships and networking. So for Malawi, it has been a very sad 3 years from COVID 2019, 2021. We have had several climate shocks, public health threats as well. We have had cyclones, Cyclone Annie, Gombe, and the most devastating one was Cyclone Freddy, which hit Malawi on the 11th of March, 2023. It displaced over 2 million Malawians. Also, some Malawians up to now still missing. I can give an example. 10th of March, it was a good day with the sun and everything else. People had dinner, you go to bed. There's this one woman, she had a family of 5. They went to sleep. Everything was okay. It hit at midnight, 11th of March. The next morning, she was all alone. The husband gone, the children gone. All of a sudden, your life flips just like this. The house gone, literally gone, everything gone. So that is the kind of impact we're talking about. Because sometimes when people hear about shocks of climate change, cyclones, they don't have, they cannot put a picture to what exactly is happening. You go to another district in Sanje. I was there the next day, 12. In a village, there's a pregnant woman who cannot deliver normally. Normal delivery, we can do it at home. It happens. Then you go to the hospital after delivery. But this woman, she needed to have a cesarean section. The road washed away. You cannot, literally no access. We don't have helicopters for relief, for emergency rescue. So these are the issues which we are talking about. So I'm saying, how do we assist this woman in the village so that she can still, have access to health services? She can still be able to deliver, even if the the road is washed away, or even if the bridge is gone somewhere. How can I assist that young lady who is supposed to go to the hospital and get refused? Maybe she's on tuberculosis medicine or ART. How do I make sure, even family planning, maybe she was due, to go and get refused. But now, because the bridge is washed away, she cannot have access. Simple things, but still very, very critical, vital things. How do we sustain health services amidst the climate shocks? We distributed the mosquito nets. We do distribute the treated mosquito nets for malaria prevention. We also give prophylaxis to the pregnant women as well. And for malaria, we have also introduced the malaria vaccine. As of now, I think we have vaccinated over 2 million children. So these are the things which we had to face. We opened the camps, in the camps, we opened the clinics for services. Most of the people who were in the camps, they had lost their health passport. Because in Malawi, you go to the hospital, they give you a health passport. So you put your details there. But then with the rains, the mudslide, most of them, the passports, they washed away.
So these are printed passports, you're saying? These are not electronic? And
No.
these are the sole records that these people have
Yes.
for understanding their health history,
Yes.
what drugs they take. They don't even know the name, unfortunately, and they're
That's
very
the
complex.
thing.
I don't know the names of the drugs.
That's the thing. That's the thing. You ask them, are you on a medication? Yes. What kind of medication were you taking? No, it was a white tablet or it was a pink tablet. I understand. Typical village setting, in the rural areas, they don't know the cotrimoxes, or they would not know such names as well. So these are the real issues which I feel that we have to address when we're talking about the impact of climate change on health. It is about strengthening, but we have to define, because all of us were talking about strengthening health systems, really not defining what exactly is strengthening health systems. It involves a lot. So we have to be, give details, and see how best do we address that.
Maybe we could talk a little bit about those details, if we could, for a moment. The government of Malawi has implemented a few plans: the National Adaptation Plan Framework, and an approach called One Health in Malawi. If you could run us through that, what those plans are exactly, share a little bit more about these approaches, what makes them more innovative, and provide an example, maybe, of how they work in action.
Okay. On One Health, basically what we're saying is that in whatever we do in our plans, we cannot ignore animals, we cannot ignore the environment. We are all living in the same environment, in the same space. We have you affect one another in one way or another, and we have seen it. So we are saying we work together, my Ministry of Agriculture, and the Ministry of Natural Resource and the Environment as well, and of course the Ministry of Finance. I'll give you an example. Now there's an issue of antimicrobial resistance. It is real. It is real. In fact, you find that maybe it's killing more people than maybe HIV/AIDS or something. But
killing more people than HIV.
Exactly. So, but it's not being mentioned frequently. It's not being given that kind of attention it deserves. But it's something which it's like we are sitting on a time bomb. It's something which we need to address. So, as Malawi, we have accepted that approach. So now what we are doing is trying to strengthen our laboratories so that they are able, to pick if there are any, resistance to the antibiotics which we use. In Malawi already we are experiencing tuberculosis and resistance in some of our patients. At least we have picked that one, and we are already addressing that one, resistance to tuberculosis medication. So that is just an example. So which shows that we really need to be alert, on high alert, everyone, and we have to keep a close eye on the resistance, because if we have that for the other diseases, it will be catastrophic.
Of course. Yeah. Very helpful. Thank you for sharing those examples. Convenings like this, WHA, COP, and UNGA in September, very important platforms for governments and organizations to make financial commitments, especially in the West, to help the Global South. I'd be interested in the time we have left to talk a little bit about your thoughts on those financial commitments. We spoke about this a second ago, just to preview. There's a lot of talk. I'd be very curious to hear your on-the-ground insight into these commitments, if they are making a difference, if they're being fulfilled.
Yes, there have been a lot of commitments, and you really have to say we have received so much support from our partners, Global Fund, Gavi, USAID, so many of them, FCDO, GIZ, there's so many of them who really, they work with us. On our own, we cannot make it. We make it because of partners, and we have had successes. We have contained the polio, we have contained the cholera as well. We are doing this because of the support of our partners.
Malawi is polio-free now, you were mentioning.
Yes, we got the message 2 days ago.
Outstanding.
Yes. So we are very, very grateful. But at the same time, the need is still there, like I said. For climate change, you are talking about preparedness. I'm talking about I need recovery, because the damages has already been done. And I think the thing which we have to keep in mind is that the crisis found a system which is already very fragile. So you're coming from not an ideal place. It was already fragile without even the crisis, because you don't have adequate infrastructure, you don't have adequate healthcare workers as well. So you already had challenges before even the crisis. So the climate shocks, they're just making it worse. So that is where we're coming from. So we are grateful for the pledges. The only problem I have is that we get so many pledges, but the way they're being fulfilled is where I have a problem. It's no commitment at all. We went to COP. There was 1 billion which was, I think, pledged. But when we're coming back, I don't think there's anyone who really has a list of who are the beneficiaries or how are they going to benefit from that pledge. So these are the issues which, I think we need to address. This is time for action, not pledges.
So you would like to see some metrics-based accounting for some of the pledges and how they are fulfilled. And indeed, I just read a report actually earlier today that some of these fulfillment of these pledges 2 years behind plans, depending on which area we're talking about, of course. So the urgency doesn't seem to be there. So what if you were to share a call to action that you would like, and on how the global north and developed countries and organizations could help more effectively? What would that call to action be?
My call to action is that this is the time for action, and not just pledges. Number 2 is the processes of getting the request fulfilled, the funding or whatever. There's so much bureaucracy, there's so much red tapes. When you're asking for help in a crisis situation, you don't have time. I don't have time to put up a 100 pages proposal for a request, and which is going to take somebody months and months to go through it. They don't even give feedback. It's a crisis. Somebody's dying. You have cholera. Everybody knows about cholera. You only have hours. I don't have even a day or weeks. So we are saying the processes, they have to be flexible. They have to be, friendly as well. So it's about the pledging and fulfillment, but it's also about the processes which we have to go through for us, to have any access at all to this kind of funding.
Wonderful. Can you, and in closing, we always like to end on a positive note. You've been here this week, as you mentioned, lots of talks and pledges. What encourages you from the discussions that you've had here at WHA 77 that you might be able to share with us on a positive note of what helps you think like we are making progress?
We are making progress. We should not despair. The challenges are there, but I think together we can overcome them. Look, HIV, 1980s, 90s, it was like a hopeless situation. Life expectancy in Malawi, I think it dropped to around maybe 35, 34. Now it's almost 65, almost hitting 70. It is a success story. We're talking about polio, we had polio, but now we have managed to contain it. It is doable. It is a success story. And so we just need to have, smart networking, collaboration as well, and also, trust, transparency, and accountability in everything, from the giver and the one who is receiving. On both sides, there has to be accountability and transparency.
Accountability and trust. I think those are great words to end on. Congratulations again on the polio achievement. That's fantastic. Thank you so much for sharing your insights and your call to action with us. We really appreciate it. Minister Chiponda.
Thank you.
Lois Pace, the U.S. Department of Health and Human Services Assistant Secretary for Global Affairs, for a conversation with moderator Dr. Maisha Alam, Foreign Policy's Vice President of Research, on the interconnected